Welcome to my channel. After conceiving, every pregnant mother is concerned about the growth and development of the baby in the uterus. After conception, various symptoms appear throughout the pregnancy. These symptoms will indicate whether the baby in the uterus is healthy or not. So, in today's video, I will discuss with you the 7 signs of an unhealthy baby during pregnancy. So let's get started. Number 1. Bleeding. When a woman conceives, her body typically produces increased level of HCG hormone, which is prevent menstruation. This means that periods will stop after conception. If someone experiences bleeding from the time they test positive for pregnancy until delivery, it is a case of concern. Bleeding before the 20 weeks of pregnancy can be an early sign of miscarriage. Bleeding after the 20 weeks can be sign of preterm labor, indicate the baby might be delivered prematurely. Additionally, bleeding during pregnancy can occur due to placental issue, which can lead to oxygen deficiency for the baby in the uterus. It is important to remember that periods do not occur during pregnancy, and any bleeding during this time signals a potential problem with the unborn baby. If this happens, you should immediately consult with a gynecologist. Number 2. Abdominal pain and back pain. Mild abdominal pain and back pain is often normal during pregnancy. Occasional mild abdominal pain resolves on its own, usually not cause for concern. However, if you experience persistent pain in the lower abdomen and lower back, or if the pain gradually intensifies, it could be sign of complication. Typically, after conception, the embryo implants itself in the inner part of the uterus called endometrium. However, if for any reason the embryo does not implant in the uterus and insert grow outside the uterus, this condition known as an ectopic pregnancy, which is a serious medical condition. Ectopic pregnancies can cause severe abdominal pain and require immediate medical attention. To ensure early detection of potential issues, it is highly recommended to have an ultrasound during the first 3 months of pregnancy. This can help to confirm the proper implementation of the embryo and detect any abnormalities early on. Number 3. Fetal heartbeat. After conception, once the embryo implants in the uterus, a space of the baby forms, known as medically as the fetal sac or fetal pool. Sometimes even after a positive pregnancy test, the sac forms but the baby is not present inside the fetal sac. In other case, the baby may be present but there is no detectable heartbeat, a condition referred to as blighted ovum. If the baby's heartbeat is not detected within 12 weeks, the pregnancy typically cannot continue and miscarriage is likely to occur. Therefore, it is crucial to have an ultrasound after 10 weeks of pregnancy under the guidelines of a gynecologist to check for the baby's heartbeat and ensure the pregnancy progressing normally. Number 4. Loss of pregnancy symptoms. Common pregnancy symptoms include morning sickness, body weakness, nausea, vomiting, and mild breast pain. Typically, these symptoms becomes more manageable after the first 3 months of pregnancy. However, if you notice a sudden decrease in these symptoms before 2 months of pregnancy, it could be sign of a missed miscarriage. This means that the embryo is no longer growing or has died. But there might not be any bleeding, abdominal pain, or other typical miscarriage symptom. The primary indicator is sudden reduction of pregnancy symptom. If you experience a sudden decrease in pregnancy symptom, it is crucial to consult with a gynecologist to confirm the health status of the embryo. Number 5. Cervical mucus. During pregnancy, the increased estrogen hormone causes an increase in white vaginal discharge, which is typically clear, odorless, and watery. This is completely normal. The discharge should not be so excessive that you need to use a sanitary pad. However, if the discharge becomes thick, white like milk or green yellowish and has a foul smell similar to raw fish, or if you experience itching around the vaginal area, it could indicate an infection. Such infection can be dangerous during pregnancy as they can interfere with the developing of the fetus and might even lead to a miscarriage. If you notice any abnormal discharge or symptom, it is essential to consult a gynecologist to ensure the health and safety of the both of you and your baby. Number 6. Premature rupture of membrane. In the uterus, a baby typically resides in a thin fluid-filled sac called amniotic sac, which contains amniotic fluid. This sac protects the baby from infection. Just before delivery, the sac usually ruptures, releasing the fluid, phenomenon commonly referred to as water breaking, which signals the onset of labor. However, if the amniotic sac ruptures before 37 weeks of pregnancy, it is termed premature rupture of membrane. If this occurs between 28 and 37 weeks, it is serious concern. When the water breaks prematurely, it can lead to infections and potentially cause preterm labor. If a pregnant woman experiences water breaking through the vaginal passage between the 7-month and 9-month, it is a dangerous sign. Immediate medical attention is necessary because timely intervention and proper medical care can address the issues and improve outcomes for both mother and the baby. To prevent complication, it is crucial to track your pregnancy week carefully. If you experience any premature rupture of membrane before 38 weeks, consult a gynecologist immediately. Number 7. Less fetal movement. Typically, fetal movements are felt by mother after 7 months or 20 weeks of pregnancy, though some may feel them by 24 weeks. If you do not feel any movement after 24 weeks, it might indicate that the baby is not growing properly, a condition known as intrauterine growth retardation. From 7 to 9 months of pregnancy, it is crucial to monitor the baby's movement. Remember, any problem does not start suddenly, so consistent movements are a sign the baby is doing well. If your baby moves at least 10 times every 2 hours, it indicates the baby is healthy. To monitor the baby's movement effectively, lie on one side after eating and count the movement. Ideally, the baby should move at least 5 times within an hour. Do this 3 times a day after meal. If the baby's movements are less than 10 times in 2 hours, it might be a sign of a problem. If you observe any of these 7 signs during pregnancy, it indicates that the baby might not be doing well. In such a case, it is essential to consult a gynecologist and have an ultrasound done to ensure everything is alright. So, I think today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to my channel for get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.